There was a systematic review in 2025 by Baker and colleagues that included 8 different exercise interventions in people who currently had diabetes-related foot ulcers. Now, of these 8 studies, only 3 of the studies were randomized controlled trials. And this type of study design, this gives us the highest quality evidence in terms of determining intervention effectiveness. In terms of safety, out of the 213 participants that were included in this review, only 1 participant had issues with their ulcer, and it was a temporary increase in fluid leaking out of blood vessels in tissue that was near the ulcer. In terms of wound healing, exercise may help with the healing process in diabetes-related foot ulcers, but overall, the evidence is considered weak at this point. And that's because only 7 of the included studies actually looked at this outcome in terms of does exercise improve wound healing. All 7 of the studies were conducted very differently, and some of them, they didn't do a very good job of describing how they actually did the study. So it makes it difficult to replicate. And so all these factors together, it makes it difficult to draw any firm conclusions. There was only 1 study in this review that looked at how exercise impacts blood sugar management while somebody with diabetes has foot ulcers. This was one of the randomized controlled trials, and so it had 2 different groups, 1 intervention group, which means this was the group that actually exercised, and 1 control group that didn't exercise. It was a 12-week aerobic exercise intervention, which means cardio, and both groups had diabetes and they both had foot ulcers. The experimental group, they rode on an exercise bike with a specialized offloading insole padding in their shoe to reduce any pressure on the foot ulcer. They started them off with only 10 minutes of exercise after the warm-up and then built up to an intensity that felt somewhat hard, which is considered moderate intensity. They then gradually increased the time spent exercising until they reached 50 minutes a session in week 9, and they continued this through week 12. At the end of the 12 weeks, the exercising group had significantly improved healing with the foot ulcer, and that was measured by a decrease in the size of the foot ulcer, and they also had significantly lower fasting blood sugar compared to the control group. The other 2 randomized controlled trials, these both focused on exercises that improve foot and ankle range of motion. And only 1 of these studies resulted in significantly improved wound healing in the intervention group compared to the control group at the end of 12 weeks.